Hello, my name is Chris Jones. I'm a urology oncology nurse at Southend Hospital. I'm speaking to you today regarding the options that might have been offered to you at the beginning of your diagnosis. One of the options that may have been offered would have been a radical prostatectomy. This surgery involves removing the whole prostate and sending it to the laboratory to be reviewed under the microscope. Nowadays, the surgery is normally done robotically and is therefore very precise surgery. Another treatment you may have been offered at diagnosis was radical radiotherapy. There are different forms of radiotherapy, and initially I will discuss external beam radiotherapy. This form of radiotherapy is very non-invasive and involves having radiotherapy beams directed at the prostate over a course of treatment up to 7 weeks. Before radical radiotherapy, you may have been offered a procedure to insert a rectal spacer or Barrigel. This procedure was to insert a substance between the prostate and the rectum to act as a barrier to help protect the lining of the bowel. This rectal spacer or Barrigel would not need to be removed, as it would be absorbed naturally by your body. Some of you may have been offered low-dose rate brachytherapy. If you were offered this treatment, you would have been referred to another hospital, as this is no longer offered at Southend. This procedure involved having radioactive seeds implanted into your prostate, and these seeds remain in situ lifelong. Following a period of time, they may have referred you back to Southend Hospital to continue follow-up locally. Another treatment at Southend Hospital is high-dose rate brachytherapy. This procedure is normally done under a local anaesthetic, is done as a day-stay procedure, and you may have been offered this as part of a combination treatment or as a treatment alone, given as 2 treatments 1 week apart. Some of you may have been offered hormone therapy as part of treatment prior to radical radiotherapy. Hormone therapy comes in different injections and tablets, and there is a separate presentation related to the use of hormone therapy. Whichever treatment you chose, you will remain under hospital follow-up, normally for at least 10 years. Initially, you will remain under consultant follow-up, and there will be certain questions discussed, and these are likely to involve urinary symptoms, sexual difficulties, bowel symptoms, and any other concerns you may have. Depending on the treatment chosen will depend on the investigations required after your treatment. Normally, following a radical prostatectomy, you will be followed up with PSA blood tests only. Radical radiotherapy will require regular PSA blood testing, but should you have any changes to your bowels or blood in the urine, then you may need to perform a colonoscopy or flexible cystoscopy to review these symptoms. Should you have hormone therapy, you will be given lifestyle advice to support with this treatment, regular PSA blood testing, and you may also be offered a special scan called a DEXA scan if your symptoms suggest this is necessary. After 1 year, you may be transferred to nurse-led telephone follow-up, and when it is deemed safe to transfer you to remote follow-up, then the nurse specialist or consultant will give you further information at that time. All patients will have the facility to call their nurse specialist, and there is a support group that patients can attend if they wish to do so. Thank you for listening to this presentation. Should you require further support, then please contact your local clinical nurse specialists.